We all know that the brain has specific functions and that the brain works in a certain way. And most of this is done just by itself. We can't control a lot of it, but what if we could? There is a guy by the name of Christopher DeCharms, and he thinks that this is possible. And he has helped to develop an MRI that can look inside your brain and look at the functions of your brain as they are occurring. Okay, so the need and really want to look inside of the brain and find out how it works and finding out about the functions has been around for thousands of years. And it's really been impossible to do this without the technology that we have today. And also it's been very dangerous, the other methods that they had. But now they can use an MRI, and MRIs have actually been around since early 1990s, but they have never been used for like this kind of purpose. So we were able to explore the brain in a more in-depth way. The most common ways to solve problems such as pain, stress, and even depression is through medication, seeing a therapist, or even having surgeries. And that's pretty much the only options that you've ever had. But with using MRI scans, you have a fourth option. And patients are able to look in their brain and see how it's working, and they're able to learn how to control that feeling. I've got a little video clip that'll kind of explain a little bit about it.
You, but we're literally reading this person's brain in real time. They're watching their own brain activation, and they're controlling the pathway that produces their pain. They are learning to flex this system that releases their own endogenous opiates. As they do it, in the upper left is a display that's yoked to their brain activation of their own pain being controlled. When they control their brain, they can control their pain.
Wow.
So, okay, so chronic pain patients are able to control their pain without having to use narcotics and even having like really expensive surgery. And in these trials, there's been a 44 to 66% decrease in the amount of pain that these chronic pain patients are having. So he's actually thinking that in the near future, you'll be able to control things other than pain. He says that maybe you'll be able to control feelings such as love, joy, and fear, and even your own intelligence level. He challenges you to think about, where do you think this will take us? Do you think that maybe eventually one day we will be able to control our brain? And do you think that that would be a good thing?